Welcome to the next edition. I think this is the fifth edition of the MesotheliomaGuide podcast. And while in the previous four, we have spoken with doctors and specialists and surgeons and researchers and even people who have worked on the new treatment, the Novo TTF system for mesothelioma, we now have Alexis Kidd. She is a 12-year survivor of peritoneal mesothelioma, and in our interview in our podcast today, we're going to take a little bit of a left turn from what I usually talk about, which is new treatments, and we're going to talk with a survivor about more so the past, her journey to this point, her diagnosis years ago, and kind of how life has changed for her, and hope that she can give to other patients who are enduring and who are dealing with this disease. So Alexis, thank you for joining me and agreeing to do this. That's awesome.
I'm so honored. I'm very excited about doing this. I'm very glad to be here.
So Alexis lives in Houston. A peritoneal mesothelioma patient was diagnosed in 2007 at the age of 37. And Alexis, correct me if any of my dates or facts are wrong. But I'm going to start right there. Again, 2007, 12 years ago. At age 37, the prognosis you were given was between 6 months and 2 years.
Yeah, that was pretty scary too.
Yeah.
At that point, I didn't even know what mesothelioma was.
So yeah, what was your initial reaction when you're told this? I know that you had abdominal pain. I think you had your gallbladder removed, but then they noticed that there was a growth on your diaphragm. And that's how they kind of learned that you had cancer, that there was something going on there. And then you find out it's mesothelioma. It's an aggressive cancer. It's really rare. There's very few treatments. And what was your reaction?
I can still remember sitting in the surgeon's office who took out my gallbladder, and he actually was angry that I could not explain to him how I ended up with this cancer. He kept asking me, are you sure you didn't live right next to a place that worked on brakes, or did you live near the shipyard? And with each question he'd ask me, he'd get increasingly angry, I couldn't satisfy his curiosity as to why I ended up with this cancer. And actually, he was my boyfriend at the time, but it was my husband's birthday the day that they gave me the diagnosis. So that was a very challenging day to just sit in the office and listen to them get the paperwork ready to go to MD Anderson, and just trying to think beyond the word cancer. It was very surreal.
It's been 12 years since that day, and mesothelioma, the only confirmed cause of the disease is asbestos exposure. And I know that's why your doctor was asking, where did you live near a place that worked on brakes, or an automobile shop, or some sort of other business or industry that involved asbestos. Do you have any idea of how you were exposed now?
And now, to this day, we still don't know. Even when I ended up at Methodist Hospital, the doctors there, they spent a good maybe 3 to 6 months trying to figure out the why. And, finally, when they couldn't figure out the why, we just tried to figure out what to do about it. And that's why I'm still here.
I gotcha. So most people who are diagnosed with mesothelioma, especially pleural mesothelioma, I should clarify that, are older. They're 70s, in their 70s, 80s, maybe their 60s. Peritoneal mesothelioma, the average age is a little bit younger, but it's 60s, 50s, maybe late 40s. You were 37 years old. That's one of the youngest, if not the youngest age I've ever seen.
It's definitely pretty young, and that was something that completely worked in my favor because they were able to first of all see that it existed in the first place. Then because I was younger and a little bit healthier, they were able to be very aggressive when they finally decided what they were going to do to treat me. And they got to learn a lot from me too, because the way that my life has gone since then, since the surgery and the chemo and everything, and maybe, they got to use their experience with me to focus on quality of life of people that are survivors, which
Mm-hmm.
is something that they probably didn't really think about because most of their patients were older and their survival rate, even after treatment, was not as good as it is now.
I know you had difficulty, or at least I've read that you had difficulty initially finding a specialist to help treat.
I did.
Why is that? Or why was that?
Um, well, part of it was um, the way that my cancer presented. It was primarily on my diaphragm, which they usually say is stage 4, and by then it's usually all over your chest, or around your heart, or it's pretty bad by the time that it gets to your diaphragm. And but it wasn't showing up on any scans, which made it difficult for doctors to see how it was growing and figure out how it got to my diaphragm. So I spent like 6 months at MD Anderson doing scans every month, and they would call me and be like, "Oh, your scans turned out great," and but not knowing what was really happening inside of me.
Mm-hmm.
And then they, from the very start, referred me to Dr. Sugarbaker. And at the time, I think he was doing like a clinical trial, and so he wasn't accepting new patients. So I went about 8 months, almost a year, before we finally found someone who was willing to help me. And luckily, it was somebody here in town, so I didn't have to travel across the country to get help. Um, my
And that was Dr. Henry Zaleski of Methodist Hospital in Houston, correct?
Yes,
Okay.
absolutely.
Okay. And then I believe did Dr. Sugarbaker step in later? Did he get involved?
Well, yes, actually, what happened was is uh, Dr. Shanda Blackman, who is a thoracic surgeon. She used to be at Methodist. She was working with Dr. Zaleski and kind of coordinating with doctors at MD Anderson and Sloan Kettering, and trying to figure out what to do to help me. And she actually talked to Dr. Sugarbaker, and he agreed to send over information on how to do the HIPEC. And my oncologist, Dr. Zaleski, was totally willing to learn how to do it. And so that's what they did. They ended up taking out the right half of my diaphragm, and they did HIPEC while I was on the operating table.
Oh wow. What was cytoreductive surgery with HIPEC, which stands for heated intraperitoneal chemotherapy? Like, what was that like? I mean, how long does that procedure take? What are the after effects like? What do you have to do any preparation beforehand for it? Like, how does any insight that you can give into first person experience? What is that like to undergo that procedure?
Honestly, I don't remember any of that. Because, basically they cut me open from, my underneath my breast down the middle of my abdomen, to open me up to take out that half of my diaphragm in the first place. So that in and of itself was pretty traumatic. I don't remember anything after surgery, but apparently I was in ICU for a while, and um, it was uh, complicated by some. My body kind of swelled up a little bit. It was like they called it third staging, and it had a lot to do with the surgery. And I'm guessing, I mean, I don't have a medical opinion about it, but the treatment of the heated chemotherapy caused some complications. But I don't remember very much about the HIPEC at all. But I remember the most that they left 2 ports in my lower abdomen after that surgery, and that's how we did the chemo, because they wanted it to be as the least amount of possible keeping the chemo in my body. That's why we didn't do an IV or anything like that. And literally, they would put the cisplatin into one port. I would lay on my side for an hour and then switch sides and lay on my other side, kind of like washing my abdomen.
Mm-hmm.
And that was what I would do for chemo, and then they would drain the rest.
The rates of or the life expectancies for cytoreduction with HIPEC, I mean, the averages of people are median survival times of 60 months, which is 5 years. Now you're 12 years, so you even topped that, more than doubled that. But it's not many patients, not many people realize that this surgery, while I imagine there are a lot of challenges for the patient, it does have a decent amount of effectiveness in terms of increasing that survival time.
Absolutely, and that's the miraculous thing about it, is you go through so much, but you get to live and you get to enjoy your life. And yes, there's challenges. There's lots of challenges, but you have more time to do whatever it is you want to do with your life, and that's miraculous to me.
How long from the moment that you get the gallbladder removed and then you go undergo cytoreduction to the last treatment that you have for meso? So like the last cisplatin infusion, like what is the time length? How long does that take?
So from when I got my gallbladder removed until last chemo,
Yes.
I'm going to guess probably about a year.
That's a long.
Maybe no.
That's a long
No,
time. Oh,
15 months.
that's
Because it took us about 7 or 8 months to find a doctor, and then from there it went pretty quickly.
that's a long time to go through that uncertainty about the future. What was
Yeah.
that? What was that like?
It was really hard because at first we didn't tell anybody
Mm-hmm.
because we didn't know what to tell them. When people hear cancer, they want to know what kind and, what are you going to do about it and how long are you going to be here? And they have all these questions, which of course is understandable, but we didn't have any answers,
Mm-hmm.
Especially not having a doctor at first.
Mm-hmm.
So we just told like maybe a handful of people, and then once I hooked up with Dr. Zaleski and we started kind of forming a plan. That's when I started telling people, and it was really hard. Even having that knowledge, it was really hard telling people because when anybody hears the word cancer, they immediately get scared,
Mm-hmm.
and then they bring their own experiences with cancer, like, that had an aunt that died, or, my mom went through this and she went through, so much awfulness, and that's hard too, kind of dealing with people's feelings about how their experiences with cancer have affected them, because that's just human nature. You just can't help it. Sometimes you just project that stuff.
Mm-hmm.
And so it is definitely a challenge walking around holding that knowledge inside and then being overwhelmed with how people felt about it once we started telling people.
Is there anything that you did either in the time following the last chemotherapy session, or maybe while you were taking chemotherapy, while you were undergoing chemotherapy, and that was 15 or the end of those 15 months? Is there anything that you did personally outside of the hospital to help your body get stronger and to help you be able to withstand the chemotherapy and to ensure that this cancer maybe wouldn't come back right away? I mean, I'm not sure if there's anything you could have done, but I'm not sure if there's anything that you did. It was just a routine thing. Maybe is a health thing. Is there something that you did that just you think did help, even if incrementally?
I don't think it was necessarily a physical thing for me. Like, I did yoga, or I was more holistic with my food or anything like that, because I was just so sick all the time.
Mm-hmm.
But I think that in my head and my heart, just having that will to get through it and having a really good support system in my husband, I think that was what helped me more than anything else,
Okay.
is the emotional and the mental aspects of getting through treatment.
For someone who survives cancer, who survives any sort of traumatic experience, and they know that other people have not survived, survivor's guilt, I know, is a possibility. Um, did you feel any sort of survivor's guilt, and do you still battle that today?
I did, and I do. It was really intense at first, probably the first maybe 4 or 5 years. Whether I lose somebody that was close to me or it was like some celebrity, I'd feel horrible guilt. Why this person who had, children and grandchildren and, a thriving business and people who love them, why them and not me?
Mm-hmm.
And I still, I mean, we just recently lost a friend to lung cancer, and I've been walking around trying to figure it out. And it's not, a thing that drags me into deep depression, but in the end, it does make me more grateful, because knowing that I'm supposed to be here for something, and I just don't know what it is. But along the way, I do get to connect and help people, and that gives me comfort.
Mm-hmm. So we're gonna change a little bit. Change course. Your husband, his name's Christian Kidd. He's a member
Mhm.
of the punk rock band The Hates in Houston. And
Yes.
a year ago, he found out that he had stage 3 of a different type of cancer. Um, and I know that he is in recovery from that cancer, which is awesome. Um, I'll start with this question: how did y'all meet? And are you a really big punk rock fan?
We actually met at an art gallery opening of some mutual friends, and he's pretty famous around town for riding a scooter with his mohawk.
Mm-hmm.
And I had just gotten a scooter maybe like 3 months before. My girlfriend shoves me over and says, "Go tell him about your scooter." And I trip over myself, and I'm like, "I have a scooter." And it was silly, but um, I guess it worked.
It worked. It
And
did.
and at the time, I kind of knew abstractly that he was a punk rock guy, but I had no idea. I mean, I didn't know until later on I that he was pretty famous around town for that. And I had only just seen my first punk rock show probably about 6 months before meeting him. And so, but now I am a total punk rock fan. I really learned a lot about music through him, and so that's been a great thing.
That's all.
He teaches me so much about music.
Him being there for your cancer and for your recovery and treatment, and then you being there when he has to go through a similar process, not the same type of disease, but still cancer, and
Hmm.
that word still has that same power to it. How much stronger did it make y'all's connection?
I can't even put a descriptor on it. It just, he was there for me every single time, and he had every faith from the very beginning that I was going to be okay. And I had the same thing for him. It just magically appeared. And, while the particulars of his treatment and, the complications that he went through were different, since I knew a bit about it, I could be there for him in a way that probably someone else couldn't, because I've been through that experience. And I can't even imagine how, I don't even know. I mean, it's just so amazing how we were able to be there for each other. And there's nothing that we can't get through as long as we're together, because we've had those experiences together.
Mm-hmm. So, and I only bring this up because and there's a GoFundMe page. I know that you have had some occurrences with health issues. I know that there was something about stage 4 congestive heart failure, stage 3 kidney disease, and other issues. Those are not connected to mesothelioma, correct? Or your
That's correct.
past, but I know it's difficult, right, for someone who went through mesothelioma, who went through that treatment, who went through 15 months of uncertainty, and then to have more stuff popping up. Um, how I'll ask this: how different was your reaction this time compared to 12 years ago, and how much has your outlook changed when something like this happens, when you are told of some sort of significant health issue?
Well, it's it's definitely scary, and certainly, having congestive heart failure can lead to a host of other problems. Um, Basically, being sick all the time can certainly take the wind out of your sails, and you can easily get depressed. I
Mm-hmm.
spent some time being depressed, and that's completely understandable.
It is. It is.
Basically dealing with chronic illness after chronic illness, it's sometimes even demoralizing. But again, I'm still here. I have amazing doctors that want to help me, and again, I have a great support system in my husband and my family of friends, and I can get through this. And just like I got through my cancer, I can get through this. And I am. I'm definitely, my heart is definitely getting stronger. It's not quite back to normal yet, and
Mm-hmm.
because my heart's getting stronger, my kidneys are getting more of the oxygenated blood that they need, and they're getting better too, slowly but surely. So
Do you,
it's a process, but it's getting better.
do you feel like going through mesothelioma and that treatment has made you? And you already kind of answered this, but it has made you kind of more prepared to handle the depression and taking the wind out of your sails. I mean, that's completely understandable. It's almost, like it's almost inevitable when something like this happens. But you've been through this before, right? And it's almost
Yes.
like what has, like, you have to just keep putting one foot in front of the other.
Absolutely, and I can. And I keep thinking back to those days of uncertainty and not knowing what was going to happen. And at least now, with what I've been going through recently, I have a plan, and I can take steps now. Like, I've been walking more, so I know that's going to help my heart. And I've been trying to do yoga more, so I know that's going to help me relax and not be so stressed out. So, there are things that I can do to try to be more proactive about these sort of things while I'm getting treated by my doctors at the same time.
Mm-hmm. Okay. Let's go back to the mesothelioma and we'll wrap up the conversation. And I appreciate you being so open and talking about everything, not just from
Of
12 years
course.
ago, but even recently. Have you ever had a recurrence of your peritoneal meso?
Well, so the last time that they did laparoscopy on me towards the end of my treatment, there were still, um, I guess they call them plaques on the left side of my diaphragm, on the
Mm-hmm.
top and the bottom.
Mm-hmm.
So I guess what they do now is they kind of just watch to see how it's growing.
Mm-hmm.
So, and I know that they do scans and they look into the specific area, and then I know also that they have a certain blood test that they do to they've picked up like a genetic marker
Mm-hmm.
of how to look and see if my cancer is doing anything crazy. And so we do those things. But actually, I saw Dr. Zaleski about maybe 2 weeks ago, and he's currently looking at all the scans that I had done when I was in the hospital about 2 months ago. And he's kind of looking at a plan to see what's the least invasive way to see if my cancer is currently being active.
Okay. Have you met any other mesothelioma patients or survivors?
Not in person, but I've talked to a few over the internet and on the phone. I've actually been very lucky to connect with family of people who are being just diagnosed,
Mm-hmm.
and they would call and we'd talk on the internet, and then they would call. We would talk about maybe things that I went through, doctors that are out there that specialize, and things. We also talked a little bit about caregiver stuff, because I talked a little bit about how my husband helped me when I was going through treatment and that sort of thing. And this is people all over the world, like in England and in Canada and here in the United States. And that is amazing to me that I've been able to make those connections.
Okay.
It's so incredible.
How much has your outlook on life changed in the past 12 years? And to that, if you had one thing you could say to any mesothelioma patient who's listening to this, whether they're newly diagnosed, whether they were diagnosed 6 months ago, whether they were diagnosed 2 years ago, and they're still undergoing treatment, what would you say to them as someone who is now 12 years since their diagnosis?
It's probably the hardest journey that you'll ever undertake in your whole life, but you can get through it. And then not only survive, but you can also make your life whatever you want it to be and thrive and be happy after going through all this. You really can. I mean, I'm proof.
Yeah. Exactly. Alexis, thank you so much for doing this, for participating. It was enlightening, and it was very hopeful. As I'm not a mesothelioma patient, but still for mesothelioma patients, it is hopeful to speak with someone who has survived for so long after their diagnosis, when the prognosis is usually much, much shorter. So again, thank you for doing this.
I'm really grateful to have been a part. Thank you so much.
Thank you, Alexis, and have a great day. And we're all, I know everyone at MesotheliomaGuide and everyone who knows of you is obviously rooting for you and rooting for Christian. And y'all are both inspirations. So thank you.
Thank you.
All right. Thank you to Alexis Kidd for participating in the 5th episode of the Mesothelioma Guide podcast. If there are any other survivors who are listening who would like to participate, you can email myself, Devin Golden, at dgolden@mesotheliomagaguide.com. The email address is dgolden@mesotheliomagaguide.com. If you'd like to know more about what we do at Mesothelioma Guide, you can also email our patient advocate and registered nurse, Jenna Campagna, at jenna@mesotheliomagaguide.com. Again, her email address is jenna@mesotheliomagaguide.com. And I'd like to say again, thank you to Alexis Kidd for participating in the podcast and for everyone who has listened.